The bones of the upper arm include the clavicle, which we looked at in the previous module, the scapula, and the humerus. The ligaments of the upper arm include those of the shoulder, which along with the muscles of the rotator cuff assist in stabilization of the ball and socket shoulder joint. Now when we look at the bones of the upper arm, we break the bones down into the pectoral girdle, which consists of the clavicle and the scapula, and the shoulder joint, which is made up of the scapula and the humerus. The pectoral girdle functions to attach the upper limb to the axial skeleton, while the shoulder joint provides movement of the upper arm. Now, the reason we highlight the difference between the pectoral girdle and the shoulder joint is because the muscles that attach to each of these regions provide different movements, and we use different movement terminology depending on which region a muscle is attached to. I want you to remember these two regions when we come back to look at the muscles of the upper arm and think about the movements that these muscles create. Now, looking at each of these bones individually and beginning with the scapula, which are also known as our shoulder blades, and our scapula, of which we have two, are large, flat, triangular bones located on the posterior thorax between the levels of the second and seventh ribs. And so most of us know where our shoulder blades are. They kind of sit at the back on the top of our trunk. Now, a prominent ridge called the spine of the scapula runs diagonally across the posterior surface. And this is what allows us to distinguish the front from the back. So this side here faces posteriorly or towards the back. This side faces anteriorly or towards the front. This section here is where the humerus or the upper arm will detach. So this side is going to be lateral. This vertical side is medial. Now, each side of the scapula is named based on the position on which it sits in the body. So we have the vertebral border, which can also be called the medial border, as it sits medially and it runs parallel to the vertebral column. So if this is sitting in your arm, in your body, you've got your arm extending out here, your vertebral column is going to run down the middle here. So our vertebral border or our medial border is medial and it runs parallel to our vertebral column. We then have the diagonal border, so we have that along here and then also along here, which we call the axillary or the lateral border. So this border sits laterally. If we imagine again, our arm sticks out here, this side is lateral. And it also runs through the axillary region of the arm. So that's your underarm region. We then have the superior border, which sits on the superior side and includes kind of this whole section here. So that whole top part of the scapula. We then have the tip of the scapula, so this little point down here and down here, which we call the inferior angle. And this part of the scapula is important when we're determining the action that a muscle creates, and we will show you what we mean by this in your lab class. Now, looking at the scapula from a few different angles here, so we have our anterior view, we have our posterior view because we can see that spine of the scapula, and then we have our lateral view here because this is the structure into which our humerus or upper arm will attach. And there are a few specific landmarks that you need to be able to identify. So we have, as we said, the spine of the scapula here is this slender process along the back. And if you follow the spine of the scapula to its most lateral edge, you come to this thickened region, which we call the acromion. So if you feel the top edge of your shoulder now, you should be able to feel this process. The acromion, as we discussed in the last module, articulates with the lateral end of the clavicle, and it forms our acromioclavicular or our AC joint. On the anterior side of our scapula, we have another process called the coracoid process. And this little process serves as a point of attachment for both ligaments and muscles. And then we then have 3 fosses, and a fossa is a shallow depression or a pit on the surface of a bone. We have the glenoid fossa, which can also be referred to as the glenoid cavity. So that's this shallow depression or pit here. And this is where the humerus or the upper arm will articulate to form the shoulder joint. So your arm attaches into our glenoid fossa here. We then have the supraspinous fossa. So that's this depression or this pit that sits here. It sits superiorly to the spine of the scapula. So supraspinous, meaning above the spine. We then have a infraspinous fossa. So that's this groove or this depression here. It's inferior to the spine of the scapula, hence infraspinous fossa. So inferior to the spine of the scapula. Moving on to the humerus, which is then the bone that actually forms the upper arm. And the humerus articulates proximally with the scapula to form our shoulder joint, and then distally with the ulna and the radius, or the 2 bones of our lower arm, to form your elbow joint. The proximal end of the humerus features a rounded head, simply called the head of the humerus. So it's a little bit difficult to see when it's all attached in together, but it's this rounded projection here that goes into that glenoid fossa or glenoid cavity. We have the greater tubercle, which is a lateral projection just inferior to the head, and then a lesser tubercle, which is the projection on the anterior side. So if you feel the very side of your humerus bone, just kind of down from that shoulder, you should be able to feel this greater tubercle. On the front side is our lesser tubercle. So greater is lateral, lesser is anterior. Then sitting in between those 2 tubercles is our intertubercular sulcus. So this can also be known as our bicipital groove. It's called the intertubercular sulcus because it's in between our 2 tubercles. It's this groove that runs in between those 2 tubercles. It's also known as the bicipital groove because the tendon of the long head of the biceps brachii muscle runs through this groove. On the lateral side of the medial portion of the shaft of the humerus is this roughened surface here, which is called the deltoid tuberosity. So the deltoid tuberosity serves as a point of attachment for the tendons of the deltoid muscle. So we have our deltoid muscles that cover each part of our shoulder. They attach into the deltoid tuberosity. Distally, we have the capitulum, which is this rounded knob on the lateral aspect of the humerus that articulates with the head of the radius in the lower arm. We then have the trochlea, which is located medially to the capitulum, and the trochlea articulates with the ulna, which is our other bone of the lower arm. On the posterior surface of the distal end of the humerus is our olecranon fossa. So remember, a fossa is a depression or a pit in the bone. The olecranon fossa is the large depression or pit that receives the olecranon of the ulna. So this is this rounded hook part of the ulna. And when your arm is straight, that hook goes into this olecranon fossa, and this is what forms your elbow joint. We then have the medial and lateral epicondyles. So these are the 2 rough projections on either side of the distal end of the humerus. They're the point of attachment for most of the muscles of the forearm. And they're also called epicondyles because our capitulum and our trochlea are known as the condyles of the humerus, and epi means on top of. So our medial and our lateral epicondyles sit on top of our condyles. Lastly, we have the ligaments that hold the shoulder joint together. And like the ligaments from previous modules and also elsewhere in the body, the ligaments are named for their location and the bones that they connect. So we have the acromioclavicular ligament, which is this top one here, and that connects the acromion of the shoulder or the scapula to the clavicle. We have the coracoacromial ligament, which connects our coracoid process to the acromion. And lastly, the coracoclavicular ligament, which connects the coracoid process to the clavicle and is made up of these two sections here.